So at the Pediatric Emergency Department, we actually see asthma as one of the main things throughout the year. There are certain times of the year when we see peaks. Around now we would see a peak with the Sahara dust, and then we also see a peak during the September to December when we also have the respiratory illnesses. A lot of viruses, a lot of flus that are going around at that time. But what is asthma? Asthma is a lower airway disease. Your airway is divided into upper, which is like your nose, your throat, and your neck a little bit, and then lower pathway is actually going down into your lungs. And what tends to happen is that we call it an obstructive airway disease, meaning that there's a block to the outflow of air. They breathe in okay, but when they're breathing out, it's as though you're breathing out through a straw. And if you ever put a straw in your mouth and try to breathe out, it will give you the feeling of what that child feels like. With that block, there are three things that are happening. One, when they're triggered by if it's the dust or if it's animal dander, or even strong perfumes or emotions, when they get very emotional, those things can trigger. And what it causes is that a lot of mucus gets produced, so that blocks the airway. The muscles of the airway does not want that trigger coming in, so it contracts the block. And then you also have swelling because it gets inflamed. So those three processes cause you to get an obstruction to the outflow. So they feel the air trapping. And how do we deal with this? Well, there are specific medications that we do use. Some of you already have at home and you would give it to the kids before they come in. And that's basically the Ventolin or the salbutamol inhaler. You all know it as Ventolin, Asthma, and it's given through a spacer device. When you administer that at home and they're not getting any better, that's when you bring them in and then we will give them nebulizations and increase in terms of intravenous medications. But we want to make sure that you all are giving the medication even at home appropriately. And that, as I said, is through the Ventolin, salbutamol inhaler and spacer. To ensure that you all are doing it properly, we'll now have a demonstration of how to do the appropriate technique with a spacer and inhaler, and Nurse Janelle will be now demonstrating.
Good day parents, good day kids. My name is Nurse Janelle, and today I want to talk to you all about how to use your inhaler and spacer device. Your inhaler and spacer may come in a package like this. So to assemble your inhaler and spacer, you can follow the directions on the box. Otherwise, I want to demonstrate how you do it. I want to demonstrate to you how you would assemble the device. So you will have your device, it may come unassembled in the box. So first you want to cover the device and using the face mask, you attach it to the end of the cover. The other end will have an opening that is to be used with your inhaler. So to use the inhaler and spacer device together, you need to first give the inhaler a good shake and insert it into the chamber. Using the face mask, forming a tight seal around your nose and your mouth, you would administer one puff into the chamber and breathe in and out for about 10 seconds. This step may need to be repeated depending on your advice sheet given to you by your doctor. So again, to reinforce, you need to shake the medication, insert it into the bottom end of the chamber, administer the puff with the face mask, forming a tight seal around the nose and the mouth, and breathe in and out for about 10 seconds. So your doctor would have given you discharge sheet to take home with you, telling you exactly when and how many puffs to be taken. So remember, this advice sheet is very important and it will help you to resolve your asthmatic attack at home. Thank you very much, and this concludes my presentation on inhaler and spacer device.